Hi, I'm Chris Hendershot, Manager of Prehospital Business Development with Allegheny Health Network Prehospital Care Services. And we're back in Studio 51 at EMS Update 2024 up at Seven Springs. Earlier in the day, we met Chloe and Paige from the Chill Project. We got another guest for you. This is Dr. Morgan Krumeich, who is also with the AHN Chill Project. So Dr. Morgan, thank you very much for being with us
Thank you.
and joining us up here. Can you tell us a little about yourself, your background, and what you do with the AHN Chill Project?
Sure. So I'm a clinical psychologist and have been working with AHN for going on about 4 years now. And right around when I came on, it was pre-COVID, right before it hit. And I started doing my work with some of nurses that were experiencing a lot of burnout, a lot of turnover. And even though I'm an outpatient clinical psychologist seeing patients, I started to take on this interest in wellness and in high stress environments and a lot of people that deal with trauma kind of on a day-to-day experience. And so fast forward then a couple of years, the Chill Project applied for a grant through SAMHSA to work specifically with first responders, mainly police, EMS. We're looking at potentially fire at some point, and they got the grant. And so I was kind of brought on. I leapt at the opportunity. Actually, I was very excited to join and working with first responders because they have very high stress jobs, can experience a lot of trauma that people don't typically experience day in and day out. And there's actually not a lot of training or a lot of teaching around how to kind of handle some of those situations over prolonged periods of time. So my job is to kind of work with those departments around their own wellness, providing training on mental health and what that looks like on the community and the calls they go on, kind of teaching them about how to take care of themselves over time, referring them to services if they need it in the community. Also kind of looking at providing more services to community members themselves, kind of getting them in touch with mental health services, knowing that first responders are typically the ones that are going on more and more mental health calls, and trying to kind of bridge that gap so that the citizens are getting more help, our first responders are getting the support they need, and really promoting wellness from a lot of different aspects.
Oh, yeah, it's really good to hear that. So I know, like, especially from what the background you gave yourself and how you came to be with the Chill Project. Correct me if I'm wrong. This is your first exposure to EMS update. This is the first time that you've been
Yep,
up here with all the providers.
it is.
Before we dive into the other pieces, what's your opinion of who you've interacted with today? What do you,
Oh my gosh.
Paul Sadie, for being with us today?
It's been amazing. The energy here is so good. You can tell people are just so dedicated. I love working with first responders specifically because it really tends to be a calling and a passion for people. It's not something you tend to just fall into accidentally. And so people really identify strongly with these jobs, and you can feel the passion and commitment here. And so it's really a pleasure and a privilege to be able to be a part of that and promote whatever wellness I can for those.
Well, and that's where we really appreciate on behalf of us with the PCS group that you were able to join us today.
Yeah,
We're also kind of hoping as you interact with everyone here that we might get you to teach some classes for us or
I
different
would
things.
love to. I would love to. Yeah.
But along those lines, and especially what your background was and what you worry about, I mean, a discussion we just had a little bit earlier was there is obviously a mental health crisis in the country. It's undeniable. There's a lot more times that we are actually being dispatched either in conjunction with police or in delay of or et cetera that we get on scene.
Sure.
One thing you really started to hit on that I liked was, can you highlight especially like what kind of steps can we take when we have that psychiatric patient that's having the mental health disorder
Sure.
in this an escalated situation? What can we as providers start to implement that we can start to maybe tone down the situation, not only for their safety, but especially ours?
Absolutely. So I think one is kind of looking at trying to check yourself. So I think we're always so focused on what's in front of us. You at one point or another want to check in with yourself as to how you're feeling. Are you getting angry? Are you getting agitated? Are you getting overwhelmed? Because if we're starting to escalate with the patient, then we're going to have a harder time controlling the situation and getting them to come down. So whether you're doing a few deep breathing exercises, just kind of taking a step back. If you're really overwhelmed, sometimes it means if you're working with a partner, tapping out and saying, hey, you got to take over. I need to take a beat. It just really means kind of just your awareness of your own stuff so you can be present with the patient and really making sure that you're helping them. Other things that you can do would be kind of monitoring your tone of voice, being aware of your body language. We tend to kind of escalate with people. And so it takes kind of an active approach to maintain low and calm, maintain eye contact so you can connect with them. have open body language if you can. This is more standoffish and kind of closed down. People aren't going to feel as safe. If you're going to be more open, it's more welcoming for people. It feels safer. Another thing is just working on the empathy and kind of reflective language. So I can see that you're in a lot of pain right now. I understand that you're really scared. I'm doing the best I can to make sure I get you as comfortable as possible. Or can you listen to me for just 1 minute? And then I would love to hear, your answers to those questions that we have. Anything you can do to just kind of let them know that you're paying attention to where they're at, what they're feeling, what their concerns are. So you reflect that back. I hear X or I can see Y. Lets them know that you're attuned and kind of there to meet their needs. Another thing that you want to do along with that kind of empathizing and reflective listening is to, take those deep breaths yourself, but you can find a common ground. So that kind of distracts them a little bit. Hey, I see you're wearing a Steelers sweatshirt, like that was a tough game last weekend. Or tell me a little bit about your family. I've got one too. Things that if you can kind of find that common ground, it kind of helps them focus that you are there to help, that you're a person too. And it can be distracting sometimes from some of the chaos and the drama that's going on. So that can be helpful. I think other things that you want to just keep in mind is, changing the environment if that's possible. Sometimes people are very activated by what's going on around them. Right. So you can de-escalate people sometimes by turning off sirens, lights, turning down radios. Like I said, using kind of your own tone of voice and language, taking them outside if they're not already outside, a lot of fresh air, and just kind of getting them away from the scene can be helpful if it's feasible to move them and they're able and willing. So those are just kind of a few. There's a lot of others. Maintaining boundaries. If someone is acting inappropriate, it's okay to be like, sir, please don't use that language, or please, can you just lower your voice a little bit? I'm here to help. Just reassuring, but make sure that what you reassure is concrete and realistic. So you don't want to give people false hope, but you also don't want to be a little too terse or assertive. So it's a fine line, but being very kind of concrete. We're going to do this, and here's what you can expect. Please don't do X, Y, and Z. That's going to work against what our goal is here, but I'm here to keep you safe and to get through this together.
And just hearing all of that, I'm like, my mind's already going towards a course that I would hope that you would work with us on. So in closing up right now, if providers seeing this video had any questions directly, what's the best way to contact you?
Sure. You can definitely call me. The number, should I share that? Is that okay?
Whatever you're willing to share.
Sure. 412-789-9883 would be my phone. You're welcome to call that, or you can email me at morgan.krumeich@ahn.org.
And I greatly appreciate it. So with that, we're going to start to go ahead and get ready back to the booth. We only got a few hours left here down at the exhibit hall. I want to thank Dr. Krumeich for joining us. But at the same time, thank you for watching Studio 51. Make sure you like and share that video. We'll see you up here. Thank you.